Hello, everyone. I'm Dr. James Whittaker, and I've been practicing men's health and sexual medicine for over 25 years. If you're older and masturbate, I urge you to watch this video till the end, because chances are no one has ever told you the full truth. Not your doctor, not your friends, not even your younger self. So here's the uncomfortable question no one wants to ask out loud, but millions of men quietly wonder about every single day. Is masturbation still healthy for me at my age? Or is it doing damage I can't see that could be destroying my health? Maybe you felt it, a weird soreness in your lower pelvis after a solo session. Or maybe you've noticed your erections aren't quite what they used to be, and suddenly a quiet voice creeps in. Is this harming my prostate, my hormones, my heart? You brush it off, but the worry doesn't go away. Because no matter how natural it might feel or how common it is, it's still wrapped in taboo and shame, especially for men over 60. Let's be brutally honest here. Most of us didn't grow up with reliable sex education, and when it came to self-pleasure, the message was crystal clear. Don't. Religious guilt, cultural shame, misinformation passed down through whispers and dire warnings about going blind or growing hair on your palms. Now, decades later, we're left in this strange, confusing place. Aging bodies, dramatically changing hormones, and absolutely no clear map to guide us through this uncharted territory. Some so-called experts say masturbation protects your prostate. Others claim it drains your vital energy and makes you weak. Some swear it keeps your libido alive and functioning. Others insist it desensitizes you to real intimacy and destroys relationships. So which is it? Here's the part that will shock you. Most men don't actually know whether masturbation helps or hurts them because we've never been given clear, honest, adult answers based on real science. But behind all the confusion, behind all the embarrassed silence, is a staggering truth that the medical establishment doesn't want to discuss openly. Over 60% of men over the age of 60 continue to masturbate regularly. And many of them are doing so with absolutely no understanding of how it's affecting their physical or mental health. They lie awake wondering, is this helping my prostate or slowly destroying it? Is it boosting my testosterone or draining it? Why does it feel amazing one day and completely exhausting the next? And here's the real kicker that will make you angry. Most healthcare providers still refuse to talk about this topic unless you bring it up first. And even then, their answers are vague, cautious, and often completely contradictory. So let's cut through all the noise and misinformation once and for all. This isn't about judgment. It's not about shame. It's not even about right or wrong. It's about understanding the scientific truth, because masturbation isn't inherently good or bad. It's a powerful tool. And like any tool, how you use it determines whether it heals your body or quietly harms it in ways you won't notice until serious damage is done. In 2016, researchers at the Harvard T.H. Chan School of Public Health published a study that sent absolute shockwaves through the medical community. They tracked over 32,000 men across nearly 2 decades in the most comprehensive study of male sexual health ever conducted. Their question was simple but revolutionary. Could the frequency of ejaculation actually predict a man's long-term prostate health and cancer risk? The answer was not just yes, it was absolutely stunning. According to their rigorous data analysis, men who ejaculated at least 21 times per month had a massive 33% lower risk of developing prostate cancer compared to those who averaged only 4 to 7 times per month. Let that earth-shattering fact sink in for a moment. The most common cancer affecting older men, potentially reduced by 1/3 not through expensive medications, not through dangerous surgery, but through regular ejaculation. That's not wishful thinking or internet mythology. That's hard science from one of the world's most prestigious medical institutions. But the prostate protection is just the beginning of this remarkable story. Orgasm, whether achieved with a partner or through solo practice, triggers an incredible cascade of hormonal benefits that most men have no idea about. Here's what happens in your body during climax. Dopamine spikes dramatically, flooding your brain with pleasure and motivation. Oxytocin surges through your system, promoting bonding, relaxation, and emotional well-being. Most importantly, cortisol, the deadly stress hormone that's destroying your health, plummets to healthy levels. Why does this matter so much? Because chronically elevated cortisol isn't just about feeling stressed. It's directly linked to high blood pressure, dangerous weight gain around your midsection, chronic fatigue, and dramatically lowered testosterone production. So when you masturbate and achieve orgasm, you're not just relieving physical tension. You're literally rebalancing your entire neuroendocrine system in ways that protect your heart, your brain, and your hormonal health. Your heart rate naturally slows down, your muscles relax completely, and your brain shifts into a powerful restorative state that promotes healing and recovery. This isn't fantasy or wishful thinking. This is pure biochemistry backed by decades of research. Now imagine this incredible sequence of hormonal optimization happening consistently, not compulsively, but regularly across the weeks and months. The protective benefits compound exponentially, creating a cascade of health improvements. Yet we almost never hear about these remarkable benefits from the medical establishment. Why? Because the conversation around masturbation in older men is still wrapped in Victorian-era secrecy and shame. We're taught to ignore it, make juvenile jokes about it, or worse, feel crushing guilt for even asking legitimate health questions about our own bodies. But here's the hard science that will change everything. The Mayo Clinic confirms that orgasm can significantly improve immune response by increasing levels of immunoglobulin A, your body's first line of defense against infections. The prestigious Journal of Urology has published findings showing that regular ejaculation may dramatically lower inflammation markers, specifically in the prostate gland. Neuroscience researchers from the University of Groningen found that orgasm leads to measurable increases in serotonin, the crucial neurotransmitter responsible for mood stability, anxiety reduction, and overall mental health. Still think this is just about momentary pleasure? The hidden pelvic floor benefits. Let's go even deeper into the remarkable physiological benefits. During climax, the pelvic floor muscles, those hidden bands of muscle tissue beneath your bladder and around your base, contract rhythmically and powerfully. Every single contraction is like a targeted mini workout for some of the most important muscles in your body. Over time, these contractions strengthen and tone your entire pelvic floor, which is absolutely crucial for several reasons. Weak pelvic floor muscles directly lead to erectile dysfunction, embarrassing urinary leakage, difficulty reaching orgasm, and complete loss of ejaculatory control. But with regular stimulation and full completion, meaning you don't stop halfway through, these vital muscles stay active, responsive, and properly toned. It's essentially the male version of Kegel exercises, but far more effective and naturally integrated into pleasurable activity. The sleep optimization secret. But the physiological surprises don't end there. Let's talk about one of the most underappreciated benefits: dramatically improved sleep quality. You've probably experienced it yourself, that heavy, pleasant sensation in your eyelids after climax, the warm, foggy calm that settles over your entire body like a comfortable blanket. That's not just simple relaxation. It's sophisticated neurochemistry working to optimize your health. The hormone prolactin is released in massive quantities after orgasm, and it sends powerful signals to your body that it's time to rest and recover. Combine that prolactin surge with reduced cortisol and elevated oxytocin, and you create the perfect neurochemical storm for deep, restorative sleep that actually heals your body. Some leading sleep researchers even suggest that regular orgasm can significantly improve sleep latency, how quickly you fall asleep, and overall sleep quality, especially in older adults whose sleep patterns have been disrupted by hormonal changes. The complete health picture. So let's recap what the scientific data clearly reveals: dramatically lower prostate cancer risk, significantly reduced systemic inflammation, healthier cortisol levels, better sleep quality, improved mood stability, stronger pelvic floor muscles, and boosted immune system markers. Now let me ask you a direct question. Has any doctor ever explained masturbation to you this way? Has anyone in the medical establishment ever connected these life-changing dots for you? Probably not. And that's the fundamental problem with our healthcare system. When no one discusses the remarkable upsides honestly, we end up focusing only on outdated shame, or ignoring our body's needs altogether. But here's where this gets complicated and potentially dangerous. Because even though the science shows incredible benefits, there are serious risks too. And most of them don't come from how often you masturbate. They come from how you do it, the way you position your body, the technique you use, the frequency, the visual stimulation you rely on, even the emotional reasons behind why you're doing it. These hidden factors could be secretly sabotaging your health in ways that don't show up until irreversible damage is done. So while the Harvard study may have shocked the world with its findings, it only tells half the story. The real question isn't just, is masturbation healthy? The critical question is, are you doing it in a way that helps your aging body, or are you unknowingly damaging yourself? We've seen the remarkable science and benefits, but here's the uncomfortable truth that most men refuse to face. Most older men aren't masturbating correctly, not because they're reckless or weak, but because they've never been educated about how to adapt this natural act to an aging body. What worked perfectly at 25 can be slowly destroying your health at 65, and you won't notice until serious, potentially irreversible damage is already done. Let's start with the most common silent issue that's affecting millions of men: pudendal nerve compression. It sounds complicated, but the damage it causes is devastating. Picture this scenario. You're sitting on a hard chair, legs spread, hunched over, maybe with a laptop open or leaning forward. You maintain that position for 10, 15, maybe 30 minutes during self-stimulation. It feels completely normal and comfortable, but over time, that seated angle can compress a critical nerve that runs directly to your genitals and pelvic floor, the pudendal nerve. This nerve controls sensation, blood flow, and muscular function in your entire genital area. Compress it repeatedly, and you could gradually develop numbness, persistent tingling, progressive erectile dysfunction, and chronic pelvic pain, all from something as seemingly innocent as poor posture during masturbation. But nerve compression is just the beginning of potential problems. Let's talk about micro-trauma. Damage so subtle you won't notice it happening until it's too late to reverse. Most men operate under the dangerous assumption that if something feels good, it must be fine for their health. But over years and decades, using the exact same grip pressure and repetitive motion, especially without proper lubrication, can cause cumulative repetitive strain injuries to delicate skin and underlying tissues. We're talking about chronic skin irritation, microscopic tears that never fully heal, persistent inflammation, and progressive desensitization of crucial nerve endings. You might not notice these changes at first, but they build insidiously over time. Suddenly, your sensitivity drops dramatically, climax takes much longer to achieve, or you can't feel anything during intimate moments with a partner. That's not normal aging. That's conditioning damage. Your brain and penis have learned to respond only to a very narrow, intense stimulation pattern. Once that neurological wiring becomes established, it's extremely difficult to retrain. This brings us to one of the most misunderstood and devastating risks: porn-induced expectation bias and neuroplasticity damage. Let's put moral judgments aside and focus on hard neuroscience. Your brain adapts and rewires itself based on what it's repeatedly exposed to. This is called neuroplasticity. If most of your sexual arousal comes from fast-cut, extreme, hyper-stimulating visual content, it literally rewires your sexual response triggers. Your brain becomes conditioned to expect that artificial level of intensity and novelty. The devastating result: when you're with a real person, slower, more natural, beautifully imperfect, your brain simply doesn't recognize it as sexually stimulating because it doesn't match the extreme neural signature your brain now requires. The outcome is performance anxiety, delayed ejaculation, or complete inability to become aroused with a partner. And if you're already dealing with age-related reductions in testosterone, decreased blood flow, or hormonal shifts, this neurological mismatch amplifies every other problem exponentially. So let's assess the complete damage. What starts as a seemingly healthy natural act can spiral into postural injuries, pelvic nerve damage, progressive loss of sexual sensitivity, emotional disconnection from real intimacy, inability to perform with partners, crushing shame and secrecy, and devastating relationship conflicts. The tragic irony? All of this damage is completely preventable with the right knowledge and approach. Now let's go deeper into why these issues develop in the first place. Here's the biological truth about male aging that nobody wants to discuss honestly. As men age past 60, several critical changes occur simultaneously. Blood flow decreases significantly throughout your body. Your vascular system becomes less efficient at delivering oxygen and nutrients. This impacts not just erection quality, but recovery time and overall sensation. Testosterone levels drop by approximately 1% per year after age 30. This affects libido, motivation, energy levels, and even the intensity of orgasmic response. Your pelvic floor muscles naturally weaken with age. Less muscle tone means reduced ejaculatory force, decreased control, and dramatically higher risk of embarrassing incontinence. Neural pathways slow down and become less responsive. The crucial brain-body connection becomes sluggish. Sensory feedback takes longer to process. Arousal becomes more dependent on mental factors than physical stimulation. Put simply, the engine still works, but the oil is old, the parts are worn, and the roads are much bumpier. That doesn't mean you stop driving. It means you must learn to drive differently and more intelligently. So what does a truly healthy solo practice look like for men over 60? It's completely intentional rather than habitual. It's gentle rather than aggressive. It's perfectly aligned with how your body actually works now, not how it functioned 30 years ago. And here's something remarkable. When done correctly, it can actually become a powerful diagnostic tool for monitoring your health. Regular mindful self-stimulation helps you stay intimately familiar with your own anatomy. You become much more likely to notice unusual lumps, changes in penile curvature, skin irregularities, or testicular swelling. These are often the earliest warning signs of serious conditions like Peyronie's disease, testicular cancer, or tissue fibrosis. In other words, conscious masturbation can literally save your life through early detection. But the benefits extend far beyond physical health monitoring. Mindful solo practice can also reveal crucial emotional and psychological patterns. Are you using it to escape boredom, numb stress, avoid real human connection, or deal with depression? These aren't moral judgments. They're valuable insights into your mental health and coping mechanisms. When self-pleasure becomes unconscious and habitual, it often becomes a default emotional escape mechanism. But when practiced with full awareness and intention, it becomes a powerful practice of connection with your body, your emotions, and even your spiritual healing. So here's the real bombshell that will change everything. Masturbation isn't just physical release. When done correctly, it's diagnostic medicine. It's hormonal optimization. It's neurological training. And most importantly, it's a mirror that reflects how you're aging, how you're coping with life's challenges, and how you're relating to yourself. But what if you could transform that mirror into a detailed roadmap for optimal aging? The 5 essential habits. Here are the 5 crucial habits every man over 60 should adopt to turn masturbation into a source of vitality rather than a hidden health liability. Habit number 1, master your position and protect your nerves. This may sound simple, but it's absolutely game-changing for your long-term health. Completely abandon the hard chair approach. Never hunch over. Never maintain any static seated posture that puts pressure on your perineum for extended periods. Instead, recline comfortably in bed with full lower back support. Use pillows strategically under your knees to relieve tension in your pelvic floor. You're not just making yourself comfortable, you're preserving sensation, optimizing circulation, and protecting crucial nerve health. Habit number 2, use quality lubrication every single time. You may not have needed lubrication in your 20s, but now it's absolutely essential for preventing damage. A high-quality, water-based lubricant dramatically reduces microscopic tears in delicate skin, minimizes harmful friction, and protects the sensitive nerve endings that allow for pleasure and responsiveness. Think of lubrication as premium oil for your sexual engine. It keeps everything running smoothly and helps prevent desensitization, irritation, and tissue damage that can accumulate over years. Habit number 3, embrace technique variety and neurological cross-training. If your brain becomes trained to respond to only one exact type of stimulation, same speed, same grip pressure, same scenario, you're setting yourself up for what neurologists call neural rigidity. That's when your sexual arousal only functions under very narrow specific conditions, making partnered intimacy difficult or impossible. To prevent this, practice what athletes call cross-training for your nervous system. Change hands regularly. Vary your rhythm and pressure. Use slower, more gentle movements. Focus on overall sensation rather than just speed and intensity. You're training your nervous system to remain flexible and responsive, which makes partnered intimacy more fluid and satisfying. Habit number 4, listen to your hormonal signals. While the Harvard study showed benefits at 21 ejaculations per month, more is definitely not always better. Especially if you're feeling depleted, foggy, or irritable afterward. Pay careful attention to how you feel in the hours and days following self-stimulation. Do you feel energized, clear, and rested? Or drained, mentally foggy, and emotionally flat? These are crucial signals your body is providing about your hormonal balance and recovery capacity. Some men thrive with 3 to 4 sessions per week. Others benefit from spacing things out more. There's no universal perfect number, but there is definitely such a thing as too much frequency. If you notice you can only achieve erections during solo practice but not with a partner, that's a red flag requiring immediate medical attention. Habit number 5, transform it into conscious health monitoring. This might be the most important principle of all. When you engage in self-pleasure, do it consciously and mindfully, not as a mindless habit or escape mechanism. Ask yourself, am I noticing any pain, numbness, swelling, or unusual changes? Are there alterations in skin texture, sensitivity, or response? Am I using this to genuinely connect with my body, or am I trying to escape emotions I'm avoiding? When used as a conscious health monitoring practice, masturbation becomes a powerful feedback system that can reveal problems early, strengthen pelvic control, boost emotional well-being, and provide genuine pleasure and stress relief. So let's completely reframe this entire conversation. This isn't about morality, embarrassment, or frequency. It's about developing a mature, intelligent relationship with your aging body. Are you ignoring your body's signals, or are you tuning in and listening carefully? Because at this stage of life, your body is constantly communicating with you. The men who age with strength, clarity, and sustained vitality are the ones who listen attentively, adapt intelligently, and make small, smart changes consistently. Here's your complete toolbox for sexual health after 60. Conscious positioning, quality lubrication, technique variety, hormonal awareness, and emotional presence. No shame, no guilt, no hiding. Just clear, practical steps to transform something you already do into a pathway toward greater health, deeper self-knowledge, and longer-lasting vitality. Because masturbation after 60 isn't dangerous when done correctly. In fact, for most men, it's absolutely essential. Essential for circulation, essential for prostate health, essential for staying connected to a body that's evolving and adapting, not breaking down. So if you're over 60 and you still masturbate, that's excellent news. Now you just need to do it smarter, more consciously, and with complete respect for your body's changing needs. Use it as a powerful health tool, not an escape mechanism. Respect it as an accurate mirror of your wellness, not a mask for avoiding reality. And most importantly, treat it as an essential part of your long-term strategy to live vibrantly, age powerfully, and own every aspect of your masculinity without apology. If you found tremendous value in this honest, scientific discussion, share your thoughts in the comments about what you wish someone had told you 20 years ago. Subscribe for more fearless deep dives into the health topics that no one else will address honestly. Your health and vitality deserve much better than shame and silence. Now you have the complete truth and the power to use it wisely. Until next time, this is Dr. James Whittaker reminding you that conscious aging is the ultimate act of self-respect and wisdom.